Hi everyone, my name is Cassie Piela, and today for my tech talk I'm going to be going over virtual reality in anesthesia education. I have no financial relationships to disclose. I will be discussing a few examples of currently available virtual simulation in anesthesia, but I do not have any financial ties to those companies. And the opinions expressed in this presentation are solely my own and do not reflect the Department of Defense or the government in any way. Here's just a quick overview of what I'm going to discuss. First, I'm just going to talk about virtual reality and medical training overall and how it relates to modeling and simulation. Then I'm going to go into how virtual reality is used in anesthesia, and it can be used both for trainees and for certified providers. I'm also going to talk about current options for virtual reality in anesthesia, why using virtual reality is so important, and what the future of virtual reality looks like in the anesthesia profession. Overall, virtual reality is really just a subset of modeling and simulation. When we talk about virtual models versus physical models like physical simulators and task trainers, they're technically more simplified than the real thing. But as we increase fidelity in both physical simulators and virtual reality, we are making more complex models that relate better to the real world and thus improve understanding. So virtual reality is also improving, just like physical simulators, as these models get closer to the real thing. There are studies in general medical education and nursing, such as a study by Lee, that's showing that successful use of task trainers does not necessarily equate to successful placement of such things on a patient. For example, Lee talks about an IV task trainer and how successful placement of an intravenous catheter on that trainer does not necessarily mean that nurses are going to be successful on a patient. And in addition to that, it doesn't really encompass all of the other tasks that generally go along with starting an IV, such as medication removal, drawing that medication up, then administering that medication through the IV, looking for side effects. So virtual modeling is allowing for expansion of just single simulation events. And on that note, we can talk about simulation and how that really involves applying manipulation and interactions to the model. And within that same study from Lee, is using that same vein really effective when you're using a task trainer that has been poked multiple times in the same place? Are you getting an effective learning experience where VR can reset that entire experience? It can actually manipulate the veins, manipulate variables, expand the scenario in the same space, so you're not having to run multiple event locations in different areas, but instead you're doing that simulation in one location using VR. Realism, virtual reality is certainly improving, and realism and the effect on technical skills, of course, can be argued either way. Sometimes it does seem like it'd be more effective to use something like standardized patients, where virtual reality is starting to offer kind of a blend between task training and standardized patients, but you may not get the same non-technical skills as you would with a standardized patient, nor would you get the same technical skills if you had a true real-life model instead of using virtual reality. There was another study that just talked about the differences in learner performance in emergency pediatric management, and the study group, one group learned virtual and the other group learned in a simulation, and the learning outcomes were exactly the same in that study. So how is VR used in anesthesia? And I chose this because I think the anesthesia field has a lot of very unique aspects to it that require visualizing certain equipment and hands-on skills that really require being immersed into that situation. The OR is very unique. It's a very high-stress field where you're making very quick decisions. So VR can be used a lot of ways. So one way is just supplemental simulation and technically hands-on practice. VR is really advanced to where we can touch and move things in the digital environment using VR. It's also an alternative to simulation experiences. So we've still been talking a lot about how the pandemic really evolutionized some uses of simulation that we hadn't thought about before, at least pushed it to new limits. So when you're talking about, students who are ill, or all the way to world crises, when you're have the ability to do simulation in a remote or personal space, it really can benefit to not having students lose those opportunities that they would normally lose if simulation centers were shut down or elective surgeries were canceled. In addition, a lot of VR is incorporating critical thinking exercises. So this picture to your right is actually an older version of Ansoff, and it's a 2D computer screen-based image. So I used this in training. It's certainly been replaced. I'll talk about the new state-of-the-art anesthesia simulation, but you can see here you have patient histories and scenarios. You have vital signs over here. You're able to change your volatile agent on this side, change your fresh gas flows over here, and you just have this entire standard set of interventions you can make with this patient. And the scenario will adjust based on algorithms so that patient progresses based on the choices that the student makes through various case samples. And then, of course, even with very robust programs, you can still use virtual reality as a curriculum supplementation, just as something extra for students to have. Next, I want to talk about state of the art in anesthesia virtual reality. So on the previous slide, we talked about two-dimensional computer gaming virtualization, where you have a computer monitor, the single license software. It's not as tactile because you're using a mouse in general to click the different aspects of the screen. And it's a bit less immersive because, of course, you're not getting that 3D visualization of something like a breathing bag opening and closing. You're not able to turn dials. And then now, in the last few years, we've really come a long way in virtualizing anesthesia equipment in a three-dimensional virtual reality field. And again, we're still looking at single licensing software, headsets, which you're gonna use your handsets and your eye headsets so you can see. These have also progressed, and I'll talk a little bit about that. But they're just virtual training. It just has a lot of advantages. So there are not as many space constraints. Yes, you have to have a safe space to be able to walk a little bit in some virtual reality scenarios. There are some costs associated with this hardware and software, but a lot of times it's still going to be less than booking simulation training. You can accommodate a large number of students because these headsets can absolutely be cleaned and shared, and these students can work at the same time. So you can have 5, 6, 7 sets of headsets and have all these students training at the same time instead of rotating through an operating room or a simulation center. And they can repeat that training as many times as they want. And some additional benefits, things like realism. So these three-dimensional virtual realities are giving you tactile feedback too in those handsets. So you're able to use your senses. It's really starting to blend these simulators and having an SP, because now not only can you feel things with your hand sensors, you're listening to these patients who have emotions and changing appearances, which you can't always get on a task trainer or as well on a high fidelity simulator. There are some concerns. So a few studies have looked at cyber sickness with use of extensive virtual reality. And then one thing I didn't think was studied enough, but that I really think is a concern, is just not getting that debriefing session, especially when you're running through complex scenarios. Yes, you're going to get feedback from the program, but are you having that opportunity to debrief these scenarios with one of your faculty or colleagues? I want to just touch briefly on this example that I was talking about, the new state-of-the-art. It's called Simvana. It's actually put together by Prodigy Anesthesia, which is a learning platform for boards and continuing education credits, and Torch Technologies, which did a lot of the technological advances. And together they just created this current state-of-the-art three-dimensional virtual reality simulation experience in the operating room. It's fully functional. It has embedded curriculum like didactics. You can do hands-on management of the airway, vital signs, even crisis management. And you're looking at things in a 3D environment that you just can't get on that same 2D screen, considering equipment like airway equipment, the breathing bag, monitors, vaporizers, the anesthesia machine itself. Everything, the drug cart, everything is three-dimensional and able to be opened and turned and connected. Other considerations is you're not going through these consumables that you are in the sim center. We're not having to throw away circuits that get damaged. We're not wasting gas. We're using a lot of air and oxygen in these simulation centers, and you no longer have to use that in a virtual reality environment. Again, we talked about space and how, yes, you do have to have the required space, usually something like 10 feet by 10 feet. But after that, you really don't have to have these large simulation centers to get the same knowledge. Cost, it of course is going to depend on what you're doing, but the upfront costs over years, if the equipment is well maintained, can actually be significantly less than going through all of those consumables in a simulation environment. These high fidelity simulators are incredibly expensive. And then, of course, considering whether or not we should really adopt this into the curriculum or just offer it as a supplementary learning experience for students. I talked a lot about why VR is important through the last couple of slides, but I want to talk about it again, just kind of in a summary standpoint. We're just looking at the same things that we see in regular simulation, but now with some added benefits. So the simulation environment, again, offers a safe learning environment. It reduces patient safety concerns, can offer technical and non-technical skills, such as, empathy through an SP, technical skills through intubations of mannequins. But now we have this combination of those two within virtual reality with this simulated virtual patient. And you're in this immersive and interactive environment with a 360-degree video field of contact. And of course, this anesthesia is requiring this 3D interaction in order for you to get comfortable when you're maneuvering in the operating room, which direction you're turning, how it feels and which direction to turn those vaporizers are only things you really can get with a 3D interaction or an actual vaporizer itself. You're requiring minimal to no support staff for virtual reality. And then, of course, anytime access to simulation facilities and operating rooms is limited, which is in a lot of first-year training programs, especially front-loaded didactic training programs, you have VR as an option to give learners that head start of what it feels like to be in the operating room. And of course, there are studies that virtual reality is proven to decrease injury, improve patient care, instill competence and confidence earlier. Again, the only downside is that debriefing aspect, and I think that's something that can be worked around and really worked on.
Welcome to Symvana, a completely immersive educational experience developed at the highest level of fidelity capable in virtual reality. An entire 400 square foot operating room and all of its infrastructure is replicated in a real-world space less than 1/10 of that size. Every detail, from the physics-based simulation of pressures throughout the anesthesia machine, to the electrical characteristics of every outlet, to even the slightest reflection of light off of every surface, is painstakingly replicated to bring your students into an operating room that is as real as the one in which they will one day work.
And that's just a quick overview video of Symvana and the type of 3D environment that learners are able to be immersed into. Lastly, I just want to talk about the future of virtual reality, mostly in medical education, but also in anesthesia. So there are some great advances in artificial intelligence, software algorithms, and that's what's really allowing us to see that VR patient that can provide empathy training. Patients are able to have, conditions and symptoms. They can look ill, express their feelings, and nurses, providers, just medical technicians can investigate these conditions and prepare diagnoses. These patients can react to different interventions. And again, I think in the future, we're going to start seeing speech recognition where we may be able to speak to our VR patient and they can produce a response. Other things like transitioning from that screen-based to immersive platforms for additional critical thinking and, resuscitative medicine. So maybe we are still using these in conjunction with mannequin techniques, but initially individuals are learning this through VR and then coming to do final test outs on mannequins with faculty presence. So that's just another way we can use VR in the future. Tactile controllers are getting lighter. Wireless headsets are now available, so you actually need less hardware. You really just need the headset in any computer that you can download software. There's remote progress checks for learners and educators because a lot of these VR programs, of course, have embedded didactic curriculum. They can have quizzes. And so as an instructor and educator, you can see the progress that learners are making from your own computer, as long as they log in when they're practicing their VR. There's going to be, of course, more training methods and plans developed around VR. So we're discovering more applicability, and those are some of the studies that are out there, seeing how can we use VR more effectively. And then, of course, we still need to be testing. So there still needs to be research on VR, even as we're finding new ways to apply it. Some future goals, just engaging virtual reality earlier in medical education training. So this certainly holds true for anesthesia, where when you're first learning, you really shouldn't be performing some of these techniques on real patients, or you're going to be more efficient if you've practiced in a virtual reality environment where, again, you can see what the breathing bag is looking like. You can know which way to turn various knobs on the anesthesia machine, where certain equipment goes. These are just really beneficial things to being in a VR environment before going into an actual operating room. And just in summary, virtual reality is important. It's important in healthcare simulation and modeling. It's important in specific fields, especially fields like anesthesia. We still have 2D virtual reality, but really that immersive 3D VR is going to become the standard, in my opinion. But they're both still being increasingly used in medical education. Having that immersive and interactive 3-dimensional VR is really showing favorable learning outcomes. We're having an overall decrease in equipment requirements and costs. Again, it's longevity because there are some upfront costs, and it does depend on the target goals and populations, and the cost of consumables that you may be avoiding. It allows many anesthesia students to interact in an operating room prior to real-life exposure, which improves their self-confidence, improves patient safety, and offers a safe learning environment. And then, of course, improvements in AI and component technologies will continue to improve the VR experience and interactive capabilities. And thank you for listening. These are my references.